Okay. Are we going to do introductions again? Or
yes, sorry, I've completely, I was so bowled over by all of the technology working so well that I completely forgot my job. I think most of you, excuse me, and now I'm coughing. I think most of you probably know me, but I'm Amanda Allard. I'm Deputy Director at the Council for Disabled Children and chairing or facilitating this session, and Adiba is ably helping with things like recording and polls and slide sharing, because they don't trust me. And I'll get Ian and Will to introduce themselves. It's been a real pleasure to have been involved on the sidelines with this research and to sort of have it seen, having seen it through. So unfortunately, because of the shortness of this session, you will literally just be getting a tiny sort of overview and then an opportunity to input. But at the end, Will and Ian will tell you about another opportunity to get involved. So if you could just reintroduce yourselves to each other in the chat, because I know in the big session it's a bit much to sort of to read everybody's. But over to you, Will and Ian, to introduce yourselves.
Okay, so I'm Ian Mail. I'm a consultant community paediatrician working down in deepest Sussex, also linked to the medical school here. And I spend quite a lot of my clinical time assessing children with possible autism and related conditions. I'm going to talk about the study that we've been working on for the last 3 years. How can we improve autism diagnostic services? Initially, the question NHS England set us, as they are our funders, was how we can make assessments more timely. We did manage to get in there high quality as well, which I think from the last group has been an important consideration. Will.
Hi, it's going round. I'm William Farr. I'm a Senior Research Fellow here in Sussex Community NHS Trust and a lecturer in child development in the Faculty of Education at Cambridge. Can we go on to the next slide, please, Adiba? So we're going to very, very briefly talk about the project. It's a 3-year project that was funded by NHS England, and this is going to be quite intense for the next half an hour or so. Ian's going to talk a bit about the project first of all, then we're going to try and rank our findings, which we'll get a link through to. There's a lot to read there, so that's why I'm talking quite quickly, because I know you've got to read quite a lot. We're then going to have a discussion about some key points that have come up in the project so far. This is all to report back our findings to NHS England by Christmas. So over to Ian. Next slide, Adiba, please.
So we've adopted an approach called Realist evaluation, which is well established now as a method to look at things like complex service delivery or complex interventions. And clearly, assessing children with possible autism comes under the complex service delivery banner. It's designed to ask questions along the lines of what works, for whom, under what circumstances, when, and in our case, we added at what cost. And an example of that, we've written a paper comparing the service in Peterborough, which has an integrated neurodevelopmental pathway, against what happens where I work in West Sussex. And if you look at the underlying contexts and so on, you can then ask, actually, Peterborough model is seen often as a gold standard, but if you move it across, say, to where I work, would it actually work? So you look at the advantages Peterborough has. It's a clearly defined unitary authority with clear city boundaries. The CDC and the CAMS teams have always been co-located, even if until 5-6 years ago there was a virtual door halfway down the corridor through which nobody ever ventured in either direction. Now they work as one team. My CAMS team are 15 miles away and in a different trust. And we have across West Sussex 2 providers for child development services as well. So how you pull all that together could be a lot more challenging. The approach we're using is mixed methods. And it starts by looking at outcomes, whether desired outcomes, so that the timely, high quality assessment, or actual slow assessment, 2-year waiting times, etc., that we're currently working to. And then from those outcomes works backwards, looking through literature, through examining individual services, what's going on, what could we check, and other factors there that facilitate or get in the way of good service delivery. In terms of our own study, we've done what's called a rapid realist review, which is effectively a literature review. We've then done a survey of current practice in UK teams, whether they're CAMS, tertiary or child development or other services, and had 128 NHS teams have responded and completed the survey, which is, considering this was done just not long after COVID kicked in, we actually are quite pleased with the number of responses we got. It did complicate our timelines, not least with ethics committees that for about 6 months would only look at COVID related studies, so it delayed our getting ethics committee approval. And then from there we've moved on, identified 6 sites, 2 that are CAMS, 2 that are child development teams, and 2 integrated trusts, where we're looking at those sites in far more detail, which has included qualitative work, including around 78 interviews of clinical staff and commissioners and referrers, spread across the 6 teams. And we've also been conducting focus groups with parents from each team, and also interviewed young people from each of the services as well. And we're currently just collecting data around sort of child journeys through the sort of diagnostic pathway, looking at ultimately to give us an idea of the number of professionals and time involved and the resulting costs. Next slide, please. And back to Will. Actually, we don't need that next slide.
Don't worry. So you can ignore that slide for the time being. So as a result of all of this work to date, we have got 26 recommendations that are coming through. Now, Adiba is kindly going to put a link to a poll, which we would like you please to click on through either your computer or your phone or whatever you've got in front of you right now. We would like you to rank your top 10. There is a lot to read, so we're going to go quiet for 10 minutes while you read those. We'd like you to think of sort of, quite quickly what your intuitive response is to these 26. So you're going to be dropping 16 of them. Don't worry, we just want your top 10 in order. And if you can click through on that, we'll come back together again in around about 10 minutes after you've read them all and you've tried to rank them. So when you click on them, you'll be able to see the complete recommendation. You'll then be able to just move it up or down, and then at the very bottom of the screen there is a submit response button. If you do have trouble with it, we know we've sent out some paper copies, or you'll be able to take a screenshot of what they are and then get us the answers to us later. So don't panic if the submit response button doesn't work. There's a couple of people it didn't work with in the last workshop we ran, but they should move up and down. We'll give you the opportunity to read all those through and rank them from number 1 that you think is the most important finding down to the one that is 10th, and then the other 16 you can just forget all of those for the time being. We're trying to see what the consensus is across commissioners, educators, paediatricians. I hope that's clear. I'm going to go quiet now and mute myself so you can get on with that. Okay, come back in about 10 minutes time.
If you do have questions as you're going through, by all means come on chat or talk, or just start talking and we will try and answer.
Yeah, and let us know if there's any technical problems, please. So I'm aware through all this. I've never done it myself. Amanda, have you looked at them yet? Have you looked at them yet? Have you got a top 10 out of this? Have you had a look? It's funny, isn't it? I've not done it yet. I've not actually looked.
I think it's completely shocking that you're making these poor people do this difficult task that you haven't actually made yourself do.
Oh, I've read them a million times, but I've not actually
Yeah, but
made myself.
ranking them, that's the discipline, that's the tricky bit, isn't it?
I'm doing the classic thing a teacher should not do. I'm asking people to do something I haven't done myself.
It's like asking for some of these, it's like asking a mother to choose between her children. That's because they're all such important things, aren't they?
Yeah, as I was saying, there do seem to be some that are emerging out of 26. I'm going to be quiet now.
Sponsored silence.
Are you meant to be able to drag and drop them?
So if you click on them, then some 2 arrows should appear. And then you just click on the up arrow if you want it to go up, and click on the down arrow if you want it to go down. So you might have to click more than once, if that makes sense.
Yeah, unfortunately, I don't think you can click and hold and move it.
Yes.
You have to kind of move it.
Yeah, I'm looking on the right-hand side.
Oh.
Yeah, no,
They're
you're on the
left.
left-hand side. Yeah, it's a bit counterintuitive.
Okay.
We have, if people find it too much, there is also the option of doing this on paper and sending that back to us later.
Oh, so we've got a problem here with the Will's saying.
Yeah, I think that might do it, because if you don't mind trying that, because sometimes it wasn't showing up if you were too quick to get to the page it needs to be launched, and you might still be on the original page. So just refresh it and see, and let us know if that works.
And just remind people how long they've got again, Will?
10 minutes, but given the discussion that happened last time, we can allow just a little bit more, because we've got until 12:30. Is that right?
Yes.
35.
Yeah. Okay. So we've got a bit.
And people, yeah, they may even want to eat at some point. But if but for some poor people on this call, they're probably heading straight into another meeting at 1:30. So yeah, we do need to finish on time.
I haven't eaten yet, so I am sharing that experience.
Good. Yeah, I did grab a biscuit because it was going to get noisy otherwise.
Biscuit or
Biscuit.
Okay, so you've got about 5 minutes left. Spit. Should say, for those who are keen to be involved in this, we are holding a national event for a whole morning at the beginning of November, when we'll put more details of that up at the end of the session. But they're very keen to get a good representative group attend that from different backgrounds. So it's not just my paediatric colleagues who decide what the services should look like in the future.
I've done.
Impressive.
There wasn't one on there that should say report should be no longer than 1 page.
Okay.
This has come up though in our discussions though, Leslie, around about an initial formulation and outcome needing to go to schools within, I think, what was the early idea in? It was sort of within a month before the fuller report comes out. And then because there's been a lot of discussion around what that initial outcome should be and who for.
Yeah, I have this argument all the time. They're far too academically written, a lot of the autism reports. I think they need to be much simpler for families to understand them.
What we're seeing is there's a sort of conflict between giving enough information that, say, if the parents are going to challenge educational support or so on, that, or even thinking towards accessing adult services in the future, that you have enough evidence why that diagnosis was made or not made. And also, I think we're keen that you've got a description of the child's strengths and weaknesses. It's not just a one-pager that says autism, discharged.
Yeah. But we don't do that
so
level of detail with any other disability.
Yeah, I know what we're one
Or
thing we're looking at locally is whether we do probably more like a 2 to 3 page summary that includes, well, if I'm doing it, a visual strengths and needs chart, a paragraph that justifies the diagnosis, and then recommendations, but then we're looking at attaching the sort of detailed stuff like the formal history, the results of the observation, like an ADOS or whatever, so that people have got that. But actually, for most people, you've got the description that you can read on the front page. Easily. Yeah,
no, we do that as well. But sometimes we had we looked across our sector, so in North Central London, and the differences in how long people spent on report writing was vast. You know, from 30 hours to 2 hours. You know, when we've got waiting lists of 12, 18 months, what are we doing?
It's also how long that we've had an issue with within our team that, depending who was doing it, oh, hang on, I don't want to leave. That actually can take several months for the final report to even be completed. Where are we? So we've got one. If we'll give you 1 more minute.
There's quite a lot of questions. It would have been easier to do them in sections, I think.
Yeah, and then
I mean they are broken down. Yeah, Leslie, you're right. They are actually in their original form. They are broken down into subsections. There are 7. There are 7 subsection themes if you've seen the actual complete sheet of all 26. But just for the purpose of this, they're not that way. But if you've been sent that sheet, you'll see that there are 7 themes that have emerged from them. They do then cluster around
the themes.
those.
Yeah.
Should we show
the? Yes, let's get the results.
Let's show the poll results. So if you haven't finished the SED, you can. This will be open for a bit longer, so you can do it or do a paper version.
Adiba, do you want to read them again to us?
Wow, they're tiny.
Yeah.
Can you read the top 3?
Yeah. Okay. So the first one is there should be careful the service organisation processes and waiting lists for parents, so they're fully prepared and understand what to expect. The second one is every effort should be made to adapt the assessment to the child or young person's age and development ability, and accompanied by a clear explanation of the process to the child or young person if they so wish. And the third one is to develop a system-wide awareness and increase professional recognition of ASD. Specialist roles such as the SEND HV should be rolled out. Population screening should be reconsidered. Those are the top 3.
Gosh, that's a bit different.
Yeah. Again, overlap between the last group, the paediatric group, and this group as well. So there do seem to be emerging themes out of those 26, which is good to know.
The screening one was one that people wanted to get rid of at the paediatric one, wasn't it? But that's interesting. Yes. And I think what's reassuring, it'd be interesting to see how this compares with the previous group and with when we ran that with a college or with paediatricians. But there does seem to be a sort of top 10 that there's reasonable agreement on, and most of the other ones below the top 10 are scoring much lower numbers. So that's quite reassuring, and we've seen that with whichever survey we've done. Anyway, we'll move on. So
and just to highlight, Ian, that Jenny's responses have been co-produced, so nice. Jenny gets a gold star.
Weighting those on a crowdsourced opinion anyway, which is brilliant.
Okay, so
let's move on to the next slide.
For the next session, would just sort of be useful, one, to give people a chance to talk a bit through any thoughts that have come from filling in the bit you've just done, but also to pick out a specific area of interest, and to get your views. When we do the bigger national event, we'll probably do 3 or 4 sort of key themes in this sort of detail, but obviously for today we've got quite limited time. But this is looking at the ideas around doing what some people call streamlined or tiered or abbreviated assessment. So where you have clear evidence to point to an autism picture that's been picked up both from health professionals, from parents, and also from other settings such as school, where you're then saying actually diagnosis seems very likely, can we then look at a more abbreviated or streamlined approach that doesn't necessarily involve a traditional full-blown multidisciplinary assessment? Next slide. Some of the issues that this might raise, and I'm sure you might come up with others when we were thinking it through, these are some of the issues. Can a streamlined assessment in clear-cut cases save time? What if the teams opt for single practitioner approach rather than MDT? Is that something that, I know it's not necessarily overtly stated in the main bit of NICE, but actually is in there somewhere. Is that something that people think would be okay, at least in a select group of children? How do we then retain the quality of the assessment? And I guess as underline that, is there a counterpoint between quality and timeliness, and how do we get to agreement over what's the right balance? If you go for a more streamlined approach, does that compromise things like the idea that you want to produce a detailed assessment of the whole child, not just whether they're autistic or not? What are the markers of a quality assessment, both from professional and parent carer perspectives? And moving on to the next slide. I guess the points for discussion, does this sort of streamlining tiered approach potentially save time? Which children could we consider this for, or does it become our routine practice? Do we bite up the bullet and think that actually single practitioner assessment, at least in a select group of children, can contribute to delivering a more timely service whilst allowing us still to do the full MDT for more complex children in terms of diagnosis? And within that, how do we keep things a quite high quality service? And again, we've explored as a group, do we move from a much more diagnostic based assessment to one that looks more, although still looking at diagnosis, is much more needs led, holistic, and things like actually, given the length of time, should we be bringing pre-diagnostic support, and how important to diagnose things like coexisting conditions, the ADHD, the mental health, the neurodevelopmental issues, and if we're doing more streamlined approaches, do we compromise on that side of things? So lots of questions. We'll get rid of the slides so that we can actually see everybody. So for this last bit, please are we going to stay
together in this one, or are we going to split? We've got 15 people this time.
I think let's stay together still, I think.
Yeah. Okay, now can we also draw people's attention to the chat, because we've got a link to some Jamboards. So if you want to make some virtual post-it notes and not talk in front of the whole group, then please refer to that. I know Adib will put the link up in there as well around these questions. But there we go, brilliant. Thank you, Adiba.
Yeah.
But if we want to open up to a wider discussion, now's the time.
So it'd be nice to see you face to face if you're happy to put pictures up, but don't worry if not. And yeah, if you can just, if you're asking a question, introduce yourself quickly as well. Well, we'll keep an eye on chat, so if there are questions there as well, we will pick those up, but by all means go through the stick your hand up approach as well.
Leslie's got a hand up.
Okay, Leslie.
Have I got my hand up?
Oh no, it's something weird with it. Looked like you'd I just thought you were being funny and you'd actually put your arm up, but it's something weird to do with your background.
I think it's my background, yeah. No.
So Jenny, you've commented on some of the co-production work you've done in Bolton. Is there anything you wanted to sort of comment from that?
I think for our parents and carers, it was very much around it not being a hidden process and a hidden pathway. I think because there's complexity in these pathways, we have a tendency as professionals not to share, and I think that's been a shift for us. So being much more transparent about where the young person is at on that diagnostic journey, so that for them that communication and information was absolutely key. But going back to some of the questions you've just popped in there, because I can't access a Jamboard, I was just posting that in the chat. I think the NHS system doesn't like it. Yeah. But yeah, in terms of that clear evidence list, we do have a clear evidence process in Bolton, but that is very much underpinned by a multi-agency approach. So we need the weight and quality of evidence in order for us to give that diagnosis. Because I think you do run the risk, don't you, of it being a yes or no to autism, and then not considering the whole child and the other needs they may have. So yeah.
I think there's evidently Jamboard is causing problems, so if you can't access it, probably if you want to put questions in or comments in the chat, that's probably going to be easiest.
Yeah.
Yeah, I think interesting comments there, Jenny. Julia.
Yeah, I mean, I would say the one thing that we hear from all our parents and carers, and what I know as a parent and carer myself, I mean, yes, waiting time for the diagnosis is an issue, and that, but it's the support that you get whilst waiting that is quite key for a lot of families, because you know, if you're sitting waiting for 2 years and you don't hear from anybody either in those 2 years, nobody checks in to see how you're coping, you know, you're just feeling abandoned, you know, as a family. And yeah, so it's explaining the process, obviously, and it is about the support that you're getting. So it's looking at the needs of, you know, all the needs of the child. And so I suppose, yeah, if you're going to streamline just for, say, an ASD diagnosis, but then what about all the other coexisting conditions? So yeah, it's a tricky one, that one. And it's also, as well, a lot of the time the schools or settings, you know, whatever education setting, you know, they're putting the barriers up still to, oh, we can't support your child because we don't know what their needs are. And it's like, no, you know what the needs are, you just don't know their diagnosis yet. But that doesn't actually change their needs.
I like Leslie Platt. You comment about waiting well.
Yeah.
Yeah, it's our new catchphrase.
What does waiting well mean?
It means exactly what was it Jenny that just said that about, you know, what else do you getting? I mean, the diagnosis is a tiny element of a whole package of family support that families need, and actually, you know, all the things that are going on, you know, contacts, and they can access groups or universal services or go to our language groups, or, you know, the parent champion work. The family hubs will probably support a lot of this work. So that actually, like you say, families aren't just sat there for 12 months, 18 months, 2 years or whatever, just waiting for somebody to rubber stamp a diagnosis. And the argument I often have with the health visitors is that they make the referral to our social communication team. They already know the child's autistic. So and that's why they're making the referral in the first place. They're often, you know, just as experienced as a lot of our practitioners, but it's how we formalize that as a process without it having to go into a specialist service, I think is something that we are definitely challenging ourselves on in our borough, and how we can spread the kind of skill set of our practitioners to be able to feel confident and have the skills to be able to, you know, diagnose themselves. It's interesting, isn't it? Because learning disability, we don't go into this much detail about, but actually that's a formal diagnosis that will be lifelong.
Samantha.
Just before we
Yes,
come
thank
to
you.
just before we come to Samantha, sorry, just to say, having tried to access a Jamboard myself, it seems very complicated. You have to go into your Google account and then you have to go into your emails. So let's just abandon the Jamboard. And
Yeah,
if there's
I think
anything you can't say in person, just stick it in the chat. Sorry, Samantha, back to you.
No, that's fine. Simple is much better, isn't it? I echo a lot of what Leslie and Julia was saying, and in Telford we've undertaken to describe an ASD pathway using that whole system approach, because as Julia said, it's not just about the diagnosis. Diagnosis is really important, and there's lots of people waiting for significant amount of times, but it's the context of that within a whole range of community support, information, training. And so what we did in Telford was bring together a group of people across education, health and care, and start to articulate what we all did separately, and then show how it could work together. And that has worked really well. It hasn't been published, because then there's the thing now about who owns that piece of work. Madness. But the whole process of doing that has led us to understand how things can match up. We took inspiration from the St. Helens approach and model, and from that commissioned a community autism hub for children. And in talking about any improvements or additional resources we're putting into our diagnostic process, the rest of us are there's going to be an implication for that. So whilst that might be the right thing to do to solve that particular part of the pathway, that is going to have some impact. So we all need to be working that together. So that whole system approach, I think, you know, is something that, particularly with ICBs, is something that we really need to get much better at.
I think it's interesting, as much as we've deliberate of the questions we could have put up, we put up the streamlined one because we thought we were particularly interested to hear what parents and commissioners thought about it, because it is potentially quite controversial.
Yeah. That's why we
but
picked these areas, because it's an area
at the same
where
time we're also very
clarity.
much pushing the sort of neurodevelopmental approach, right, and almost saying, and it's interesting talking to our expert advisors who were part of the team that put NICE and before that NICE guidelines together. Actually, if you read the detail, it describes the neurodevelopmental pathway. The reason you have an MDT is you need access to competencies in mental health, neurodevelopmental, that can describe the whole child, not just their autism. So we very much recognise going forward that to us that is the right way. We also recognise if you just, as a commissioner, tell your teams that's what you want, and we're saying this to NHS England as well, without significant resource and thinking it through very carefully, a bit like you've described the whole system response, you will crash the diagnostic teams, and a number are at breaking point or beyond already. But if you suddenly tell my team to take on the ADHD work alongside the autism work, much as I think it's the right thing to be doing, our team has no capacity to do that work. So without resourcing or working out how you can get CAMS and CBC to work together in an area like mine, where the trust, although clinicians talk to each other, the trusts are not great at that.
Well, that's why physical and mental health services need to integrate.
Yeah.
Just a reminder, Ian, you've got 2 minutes left.
Okay. Any last points? So what I'll do, if we go on to the last slide. This is, we mentioned it whilst you were all filling in the questionnaires, but we are holding a much bigger proper consensus event on November the 7th, which is a Monday morning, but we should have about 3-4 hours, and where today we've had 40 minutes that had to be very rushed that will be a time, yes, we can still get people to fill in the recommendations, but there'll be far more time for this sort of discussion and to look at some of the broader topics. Yes, today we focused you on the abbreviated or streamlined approach, but there are a number of other broad ideas. Where does skill mix fit? What do we think about neurodevelopmental pathways, etc.? And it'd be brilliant to have any of you along. We're keen that we get parent input, that we get commissioner input, clinician input, and not just my paediatric colleagues. We do want people from CAMS backgrounds, etc., speech therapy. So yes, we would love you to come.
Brilliant. Thank you, Ian. Just a reminder that this link will go out with the slides. Adiba, could you just put the link to the what do I mean? You know, the survey that you get at the end of a session. What's that? Feedback form. That's the word I was struggling for. Into the chat for me, for people. I know some of you won't have time, but please, if there's any way that you can find the time to fill in the feedback form, DFE do like to know that people have got something out of the sessions and that we're not just, you know, having a good time and doing it for our own, you know, nefarious reasons.
Huge
So
thank you to you all for taking the time, because I'm conscious we've probably got more from you than you've got from us after the session, but it's been really good to hear your views and to help us as we go forward to talk to feed recommendations back to NHS England as over the last bit of this year, that we've got your views and feedback. That really does help us. So thank you.
Super. So yeah,
Where's the feedback form, Amanda?
It's just literally just gone in the chat now, Leslie. So
there it is.
so yeah, so thank you, as Ian says, thank you so much, everyone. And I know, as Ian says, you didn't get to find out so much of the richness of the research, but there will be more of that on the 7th of November. So maybe it was just a little taster, a little amuse-bouche, as they say in those posh restaurants, for you to come back on the 7th of November. So lovely to see you all. Thank you so much for staying the distance. I know it's a long morning, but it's you know, these things work because you all come. So thank you so much.
Thank you.
See you all. Bye.
Bye.
Thank you, everyone.